New federal laws that will make it easier to see the cost of medical procedures and drug prices are just days away from going into effect. Our Doug Reardon joins us now to explain what exactly that'll look like. Doug.
Yeah, good evening to you, Annie. And those new laws go into effect on the first of the year. Of course, that is Friday. And starting then, hospitals and health systems will have to put something up on their website that looks a little bit like this. It's a menu with all the categorized services that they offer. And when you click on them and put in your insurance info, you can find out how much they actually cost. But as helpful as this will be, in talking to a health expert today, he said there is one big piece of information still missing.
Like food and drinks on your favorite restaurant's menu, when the calendar flips to 2021, hospitals will be required by law to list the prices of their services in a way that's easy for you to see.
If it deals with a hospital, all services need to be included.
Dr. Mark Fendrick is director of the University of Michigan Center for Value-Based Insurance Design. He's devoted the last 30 years to studying price transparency in healthcare.
More price transparency would inject greater competition into the healthcare market and ultimately improve quality for our patients and lower costs.
Mandated by federal health agencies like HHS and CMS, the new laws require that hospitals list the prices of over 300 services minimum, noting discounts for patients that pay in cash.
This includes care for doctors as well as drugs, supplies, and facility fees.
All of it made available in what the government calls a, quote, consumer-friendly format. But Dr. Fendrick says while it's good information to have, be wary of what's listed.
The rates that are going to be posted do not provide out-of-pocket costs.
That's right. The costs that are listed online aren't the costs you'll pay. It's just what your insurance will cover after negotiating with the hospital. But hold on, because there's another piece to this law set to roll out the first day of 2023 that will require insurance companies to make their own menus for the price you'll pay.
Because without that, I'm somewhat minimalist about how impactful this new rule will be on actual patient behavior. Americans with insurance typically don't care about rates negotiated between hospitals and insurance plans, but they care what it costs them.
There's already been some pushback on this law from hospitals. On Tuesday, the U.S. Court of Appeals rejected a lawsuit to block the law filed by a group including the AHA and the Association of American Medical Colleges.
Hospitals have argued against this rule primarily on the basis that they feel it would be very costly for them to prepare useful information that's required.
In a statement to Fox 17, Spectrum Health said the group was, quote, fully committed to price transparency and understands it's imperative that people have the necessary information to make informed choices about their health care, unquote.
And shortly before showtime, we heard from Mercy Health, Trinity Health, that group. They said they will also be complying with these new federal laws. Hospital systems that don't could face daily fines. And Annie, one more thing that Dr. Fendrick mentioned as important, low cost doesn't always mean high quality and vice versa. So while this information is very helpful to have at your fingertips, there is still a little bit of work to be done on the part of the patients to figure out where they can get the best care. Back to you.
Lots to consider, Doug. Thank you. Governor Whitmer signed a pair